Hello everyone, I am Dr. Rakesh Koudki. I am a board certified plastic surgeon. So today we had a very interesting case, and that's a rhinoplasty, also called as a nose job. Basically, I would start off with what my patient had and how did we proceed with that. So my patient was about 33 years old female, and she was looking for a bit of refinements in the nose that she had. But let me start off how it was actually. She had a bit of stout, also called as a little short nose. She didn't have much of elongated nose. For her facial profile, she had a very stout nose, and there was something called as a boxy tip, where there's a very ill-defined tip, which we call it as a boxy tip. And also, she didn't have a bit of a straight profile or the dorsal aesthetic lines. So we had to recreate all of this, mainly the dorsal aesthetic lines, that taking care of the nasal tips, or the boxy tip has to be removed, and also a bit of lengthening of the nasal tip. So these were the conditions that we had to address, and also there was the difficulty in these conditions, or in her case, was that the septum was too small because of the entire profile of the nose, which is very small. The septum harvest may not be that successful in such conditions. So it becomes much more challenging for us how to take care of things, because whatever you reconstruct inside, it might not be visible on the outer side. That's the So after we analyzed what we need to achieve, the first and the foremost thing that we do is there are two varieties, either the open technique or the closed technique. I prefer the open technique because we have a lot of things to do, and we have a lot of things to work on the nose to give the perfect desired appearance what the patient is looking for. I always do an open approach, but I do also do a closed approach. In certain conditions, what we did is we put a small incision over here, it's called as the inverted V appearance, and completely de-roofing the skin and completely separating the cartilage, basically the lower lateral cartilage from the medial cruras and everything. In this particular condition, it was very, very difficult because the patient had a bit of piercing all around her nose. I would say she is a sort of, the fancy thing that they put for rings over here, 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 everywhere. So much of because of these piercings, what happens is the additions and the fusions are much, much higher in that conditions. So whatever you try to remove will be all adherent over there. And also because of the stout nose, the columella strut, or probably even when I say the medial crust, is very, very thin like a paper. So it was very challenging for us to even de-roof. So we took some time, but it was all in the end, it's all good. After we de-roof, we give a nice columnar strut to give that nice sort of appearance, or probably even the height that is actually looking for. And we did a tip defining points in the medial cruras or the lateral cruras. And then finally, we had to go in the septum. To take out the septum, we raise the mucoperichondrial flaps, take out the septum, use the septum as your strut and other sort of onlay tip grafts and dorsal tip grafts. And the most important point over here, she had a very big margin of the lateral upper lateral cartilage, or the lower lateral cartilage, which we say, and we did have to do a cephalic trim. And after you do a cephalic trim, immediately the boxy tip appearance will be gone. And there are certain intricate details in the surgical steps that we have to do, but all in the end, it's all done well. So and after all the conclusions that we thought of, and probably we were a little skeptical whether we were able to achieve the aesthetic line that she was actually looking for. She did have a broad nose that we say, or the broad dorsum that we say. I thought, okay, fine, she might be a candidate where I can give a good results after doing an osteotomy, or we also called as a lateral osteotomy. And I approached to the percutaneous approach, not to the internal approach. There are different techniques. I prefer this one. So after we approached the percutaneous approach, you have a very nice dorsal lines and much more slimmer looking nose that she's actually looking for. So it will be all slim, good, thin, and the tip is very sharp and pointed, and as she's looking for. So if you're one of them who is suffering or have any queries, please don't hesitate to reach out to us. Thank you.